According to the Center of Disease Control and Prevention, or CDC, on average, 115 Americans die every day from an opioid overdose. Do you have a family or someone you care about? Maybe a brother, sister, mom, dad, aunt or uncle, cousin, or friend. What if one of these people you cared about died from a drug overdose? How would you feel? What if you could have done something to prevent it? I have very strong feelings towards this subject, and for the past week I have done extensive research by looking at credible articles. The increase in drug overdoses in America is caused by doctors not regulating prescribed opioids, and this may be solved by a safety limit policy. Let's look at the significance of the problem. Drug overdose has been a problem for years, but lately it has increased to historical rates. The Washington Post explains that new data shows that the leading cause of death in our nation is drug overdose, and is the leading cause of death in many states as well. Today, it is hard to get the number of how many people overdose, but the way researchers find out is by looking at the death rate of overdoses. The higher the death rate means that the number of people overdosing has increased. According to the CDC, in an analysis of the 2016 U.S. drug overdose data shows that America's overdose epidemic is spreading geographically and increasing across demographic groups, as more than 63,000 people died from an overdose in 2016. CNBC says the national rate for drug overdose in 2015 was 16.3 per 100,000 people. These increases of overdose have been happening in all ages, genders, and race. CNBC explains that from 1999 to 2015, men's overdose death rate doubled, women's nearly tripled, including all ages 15 and older saw an increase in overdose death rates. Whites increased 7% each year, African Americans and Hispanics 2% each year. Now that I have fully discussed the significant problem of drug overdose in our nation, I will address its main cause. The increase in drug overdose is caused by doctors not regulating prescribed opioids. What are opioids? Well, according to the FDA, opioids are powerful pain relievers that most doctors prescribe to their patients that have intense pain. Opioids can also be drugs that doctors don't prescribe, such as heroin, but prescribed opioids have been a big factor. The National Institute on Drug and Abuse says in 2015, nearly 18,000 overdose deaths were from prescribed opioids, and only around 13,000 were from heroin. The CDC explains that out of the 63,000 people that died in 2016 from drug overdose, 66% were from opioids, and out of that percentage, about 32,000 deaths were from prescribed opioids. These people are getting drugs in many different ways. 27% get them from their own prescription, 26% get them for free from friends or family, 23% buy them from friends or family, and 15% get them from drug dealers. According to Dr. Alan Jetta, the U.S. Department of Health and Human Services have published data showing that at least 2 million Americans have an opioid use disorder, or OUD, involving prescribed opioids. Professor James Hodge explains, our youth are in danger. They are experimenting every day with prescribed and illegal opioids, along with other users. He says, millions of Americans are at risk of short and long-term morbidity and mortality unless considerable strong public health interventions are undertaken. Finally, we will address the solution to this problem. There must be a safety limit policy put in place that regulates how much pain medication patients can get in order to solve the growing drug overdose rates. In order to help solve the problem with increased overdoses, some states have adopted a program. Deborah Salina explains that this program is called Prescription Drug Monitoring Program, or PDMP. She says these programs are designed to monitor for suspected abuse, diversion, or inappropriate prescribing in each state. The programs have an electronic database that tracks how much has been given out and how many refills have been made of a prescribed substance. This way, one could identify patients that may be at risk. New York and Tennessee are two states that adopted this program. According to the CDC, in 2012, both states told their prescribers to look at the PDMP before giving their patients opioids. In 2013, New York had a 75% decrease in patients going to different prescribers for the same drug. And in Tennessee, 36%. In Oregon, they adopted a program called the Core Violence and Injury Prevention Program. The CDC says, with this in place from 2006 to 2013, the state has had a 38% decrease in opioid overdoses. We must stop this increasing rate of drug overdoses in our nation, and I would like to tell you how you could help. As I have shown you, the increase in drug overdoses is caused by doctors not regulating prescribed opioids. I have also shown you that it could be solved by a safety limit policy. Now let me show you what you can do to be a part of this solution. The biggest problems start with the simplest solutions. A simple way for you to help this problem is go out and tell your friends, your family, or post on social media. Let everyone know that this problem needs to be fixed. Us as citizens have a great power to speak freely. Let's use that power to fix this issue. Overdose deaths have been increasing for over a decade, and it's time that we take action. Don't let you or someone you love be a victim of prescribed opioids. Thank you.